the main feature of why we talk about race inequality in mental health and why we have to pay attention to it is that the outcomes for people who come from black and minority ethnic communities in terms of mental health services and the treatments and the outcomes that arise for them are poor compared to their white counterparts. What the Race Disparity Unit has done is look at all the different sectors of the public, where the public purse is spent, right? And you will see across criminal justice, education, mental health, physical health, what else is there? Employment, housing, some civil roles, that across all of those sectors, right, there is disproportionality and disparity according to one's race and ethnicity. So the first report has come through alongside the Lamy Review, which is of the race in relation to the criminal justice system, and exposed the fact that even though black people have been saying, you know, we're not being treated right, you know, we're not being treated fairly, we're being treated differently than somebody else, you know, and this has been happening for like decades, and you know, we're not satisfied with services. Even though we say that, actually the data hasn't been there to support what we're saying, so we're ignored in that regard. But when you have the data now across each of those areas, public sector areas, actually exposing the disparity in either detention, for example, higher levels of school exclusions for people from black and minority ethnic communities, particularly African and Caribbean children, overrepresentation, so you've got exclusions or detentions, or in some cases, which is pertinent to the mental health field, actually deaths when people go into service. So you go to a place, a health service, for care when you are at your crisis moment, where you are your most vulnerable, and actually for whatever reason that goes on in the heads of those people are there to take care of you, i.e. what I would call the unconscious bias, the stereotypes, the assumptions, the presumptions, the implicit bias, sometimes the explicit bias, that informs the decision-making processes that determine what kind of treatment you get, what kind of access to what kind of treatment you get, at what point, and in what form, right? It's distorted according to your ethnicity.
The University of Huddersfield, inspiring tomorrow's professionals.